It is indeed a pleasure to have the honor to say a few words about Larry Dorr, a true icon in hip and knee surgery and in orthopedics in general. Sir Isaac Newton popularized the saying, "I have seen further by standing on the shoulder of giants." Larry Dorr was truly one of our giants. You know, we know about Operation Walk and the many great things he did there. He has served so many and allowed so many others of us to help others through this organization. But let's not forget everything else he did. Up until the end, Larry was still innovating. He was still teaching. Near the end of his career, he was still figuring out spinal-pelvic relationships, and he could teach that topic better than anyone. Not only that, he was at the forefront of revolutionizing orthopedics with computer-assisted surgery and robotic surgery toward the end of his career. So, very impressive.
I'm here to give you some kind words concerning a great friend of AAHKS, Larry Dorr. Larry was, of all things, a great man. He was a good case. He was a good round of golf. He was a well-told story. He enjoyed a great meal and a great bottle of wine. And these are all components of a great life lived. He encompassed all things Iowa, Cornell College, the University of Iowa Medical School. He was a veteran of the Naval Medical Corps, rising to the level of lieutenant commander. He did his residency in California at USC. He did his fellowship at the Hospital for Special Surgery, where he met his lifelong friend and collaborator, Dr. Chit Ranawat, and also studied under Dr. Alan Inglis. He met Marilyn in 1966, and they had a very long run together with many children and many grandchildren, and lived a wonderful life together, and she was part of it all. He returned to LA to go into practice at USC. He was a founding member of the Hip Society, the Knee Society, and AAHKS, a tremendous Triple Crown accomplishment. He was internationally renowned for patient care as well as for teaching, with his international videoed courses. He was also a prolific author, both academically with papers and chapters, but also in books, both fictional and non-fictional and orthopedic surgery related. But the accomplishment that he will be remembered most for in AAHKS, I believe, is his humanitarian achievements, for which he's received many awards. But he was the founding person of Operation Walk, and Operation Walk has delivered many thousands of total joint replacements in over 25 countries by 20 different teams. And Larry is going to be recognized throughout history as the father of Operation Walk. And that spirit of charity and professional altruism is unmatched.
Larry was one of the hardest working people I knew, always pursuing new frontiers of surgical techniques and adopting emerging concepts with enthusiasm even to the very end of his career, while others of his age were more comfortable clinging to established ways of the past. Blessed are those who were Larry Dorr's friends, because he was a loyal and trustworthy friend in return. Larry, we know that you have a place of honor in the heavens, and that your spirit is with us. Your memory will live in our hearts until some of us join you there in time.
I'm just so appreciative of all the help Larry and his team gave us to help get Operation Walk Denver off the ground. And it's kind of interesting because about 6 months ago, I ran into Larry and I said, remember all that help you gave us to help get Op Walk Denver going? I just wanted to let you know it really has paid dividends. And I shared with him that Operation Walk Denver has now performed over 1,900 free hip and knee replacements for the poorest of the poor. I promise that he just beamed after he heard that. While I did not train directly under Larry, I always kind of considered him a pseudo-mentor for me. He was certainly someone that I always looked up to and really aspired to be. I learned so much from him over the years, and I can't think of sharing with you how many things that I've learned from him that I've actually incorporated into the care of my practice in Denver. In more recent years, Larry and I shared a deep research interest in how spinopelvic mobility patterns of patients affected the ideal cup position in total hip replacement. Larry was one of the first people to bring this issue of spinopelvic mobility patterns and its effect on total hip replacement to the orthopedic arena. I know it has certainly changed my practice as far as how I evaluate patients before hip replacement, and it's actually changed my operating technique in the operating room to improve my precision and hopefully get better results. His accomplishments in so many areas assure that his legacy will live on forever. I miss him, I think of him often, and there's no question that Larry will be part of every Operation Walk Denver trip that occurs in the future. Thank you, Larry, for all you've done to influence my life.
Larger than life is a term you'll often hear used in describing Larry Dorr. The guy was a dynamo in hip and knee replacement surgery. He was an excellent surgeon, an innovator, a pioneer, a researcher, an educator, and to many of us, he was a mentor. Of course, he was a humanitarian. All those aspects roll up into form the Larry Dorr that I know. With his innovation and his research, he was constantly seeking to understand, and he improved what we do as orthopedic surgeons. He was always trying to be bigger and better and understand more. And that's what I learned the most from Larry, and that's what impressed me the most, that drive to constantly improve. I measure impact while we're here as the number of lives we've sincerely touched. Any part of Larry's career would be worth celebrating, be it his own clinical work, his research, his innovations, or the thousands of lives he touched through Operation Walk. Operation Walk, I'm certain, was what he wanted to be his legacy. Larry has left a tremendous legacy. Not only has he touched millions through his work, but he'll continue to do that because of those who are dedicated and who've learned from him and who'll carry it on. We were all very fortunate to have Larry here, and I'm particularly grateful that our paths crossed.
In the last 10 years of his surgical career, he did not become complacent, just finishing out an accomplished career, which in addition to his surgical practice, he led every important arthroplasty organization in the United States. Instead, he became a pioneer in minimally invasive surgery, outpatient arthroplasty, computer-assisted surgery, and the understanding of the relationship of spine stiffness to total hip outcomes. In addition to surgery, he demonstrated his creativity and versatility in becoming a novelist. I, like all of you, enjoyed so much and learned so much in so many diverse ways from having known Larry Dorr as a colleague and friend.
I've accomplished a lot in orthopedics, a lot more than I thought I would when I was a little boy, dreaming about being a doctor in Iowa. And I've got an international reputation that I never really expected, but I still think that Operation Walk that'll be my crown.
And then you walk into town. You come from a foreign country, and you tell this patient that you can fix him. And they want it so badly that they don't know you, But they trust you enough to lie down and let you cut on them. And you fix them. And afterwards, you stand at the bedside and you look at this glowing face. And the tears are coming down the face, but it's not the face of the patient. The tears are coming down your face because you know you've given life to this patient again, and you've done it without any expectation of any reward. It is Rabbi Harold Kirshner who wrote that the soul does not want money or fame or power. The soul wants meaning.